April has a very important and potentially life-saving distinction. It's Organ Donation Awareness Month, and to help us understand what that means for children and infants and teens right here in West Michigan, we have Dr. Julia Steinke with us, the medical director of the pediatric kidney transplant program at Helen DeVos Children's Hospital. Thank you for joining us this morning.
Well, thank you for having me. It's a pleasure.
When you think about kidneys, we all know that you need your kidneys, whether you have one or you have both. But it can happen where there's a big problem with kidneys, not only in adults, but also in children. That's what we're going to dive into today, because the issue is a lot bigger than a lot of people might think. So first off, let's talk about what the kidneys actually do for our body.
Sure. The kidneys do a lot more than what people think. How I explain it to families to help them understand is that kidneys are really the washing machines of our body. They help clean out the toxins and get rid of the extra waste and fluid that our body doesn't need. But they also do other things that are really important that people don't realize. The kidneys produce the hormone that helps us make new red blood cells, which is why when people have kidney failure, they develop such significant anemia. Also, the kidneys help activate vitamin D. So that's a huge reason why children who have kidney disease tend not to grow very well and tend to have short stature. And it also helps regulate our blood pressure, which is a big reason why I see children, and when they come to me with high blood pressure, it actually turns out that they have kidney disease.
Yeah, so you're mentioning some of the things that can go wrong if there is a problem with the kidneys, and it's way different in a child than it would be in an adult. What other risk factors are there for children that have kidney failure?
Well, different from adults, children are developing and they're growing. One of the earliest symptoms that families might notice is that their children is not growing, isn't thriving. Babies can be born with kidney disease, and that's a big cause for kidney failure in infants, is that there was a congenital anomaly that took place. But that poor growth and development is huge in children.
Yeah, my father is actually a transplant recipient,
Okay.
so I've seen this firsthand. But for a child that is so small and sometimes a newborn, at what point do you realize, and does the parent realize or a physician realize that something needs to be done and a transplant might be the right answer?
So a lot of times we know before the baby's even born. Every woman who's expecting gets that 20-week ultrasound. And at that time, they look to see, are there two kidneys? Is there normal amniotic fluid? The kidneys actually produce urine during prenatal time, which is actually what the amniotic fluid is. And without that amniotic fluid or urine from the baby, the lungs don't develop. So there's lots of repercussions for babies who are born with kidney disease or abnormal kidneys. And at that time, a lot of times we'll meet with the families, mother and father, prenatally, and talk about what we're expecting after delivery. Our urology colleagues also do the same thing. And we'll often meet them right after delivery to talk about things.
Yeah, you see these patients every single day at Spectrum Health Medical Group. So let's talk about some of these special cases.
Yes.
We have some photos, and I'd like you to talk to us about this girl because she just received the transplant.
So this is one of my most special patients. Her name is Acacia Rooks, and she just received a kidney from a living unrelated donor, a friend of the family, 2 days ago.
Wow.
And this picture was both of us in the pre-op area on the day of her transplant. And she's doing wonderfully right now. She's kidney is functioning well. She's producing lots of urine. And one of the great things that I love after transplant is these kids get to eat things that they have not been able to eat. And now it's so cute because Acacia asked me when I said, what do you want to drink? And she said, am I limited to 800 milliliters? So 800 milliliters is what she was limited to. And I said, no, honey, you can drink whatever you want.
A normal child.
A normal child. That's what they're getting back from this life-saving procedure.
There is another special boy, and we know the need is great.
Yes.
But you're going to tell us how great it is here in Michigan. Talk to us about this boy. This is Jazeera.
Yes.
What an adorable little guy.
So another cutie, Jazeera Westerfield. He is 5 years old, and he is one of those little boys that I met on the very first day of his life. I met with his mother and his father and the rest of his family, and he had a condition called posterior urethral valves. And so that is an abnormality that happens during development where there's a blockage, the kidneys do not develop normally, and so he had kidney failure at birth and started on peritoneal dialysis while in the neonatal intensive care unit. And he has been on dialysis his whole life.
4.5 years, and he's just 5.
And he's 5 now. So, and he's been waiting for a kidney and does not have a donor, unfortunately. So he's one of those children.
Waiting.
He's waiting, you know, and he needs that life-saving gift so desperately.
Yeah, and so many people would qualify to be a donor.
Yes.
But they have no idea that they would qualify because they haven't been checked. And it is an easy process.
So easy.
How great is the need here? Because he's just one of the many faces here in West Michigan that are waiting on this list and going through dialysis day after day after day.
Right. There's 10,000 children that are waiting for a transplant right now. And most children wait 6 to 12 months. So actually they don't wait that long because children do get priority on the wait list for a deceased donor. Of course, if you have a living donor, you don't go on the wait list. You just get scheduled for your transplant. Mm-hmm. And actually, most of our patients get living donors, about 50%, I would say. Yeah. So the need is great. Unfortunately, he's one of the outliers that has waited much longer than the average child.
Yeah, and a transplant could change a life so drastically. And like you said, the need is great. So many people could help change a life, and they could do so by doing what?
So there's a couple of ways they could do that. We have some websites on display right now that
we'll
they could
have
go
those
to.
up on our website as well.
So they could go to our website at helendevosschildrens.org/for-the-kidney-donor, or go to giftoflifemichigan.org/go/spectrum. And what that'll take you to is a link that will give you, you'll just fill out some basic information about yourself. That goes to our living donor coordinator, and she will give you a call back and explain to you what the process is. And at first, you know, we start out with just some basic blood tests. We want to know what your blood type is, but we also keep in mind we want to do the best thing for the donor.
Right.
Kidney donation is a safe procedure. It's done laparoscopically. Donors are usually in the hospital about 3 days or less. There is some recovery time. We want to make sure that you're not, that you have insurance and that your work employment isn't going to be impacted, because we want this to be something that is really a selfless gift that you're giving.
And it is such a gift.
It is.
And so many people could give this gift.
Yes.
Thank you so much for
Oh,
everything
thank
you're
you.
doing.
Thank
we
you.
appreciate it. Don't go away. We'll be back after this quick break.
Are you West